we're used to having to be creative, and we're also often used to being forgotten and left behind. And unfortunately, that's kind of what happened here, was that we slipped through the cracks and we were not given vaccine originally. And so I really was worried about that. When I saw other facilities getting vaccines across Los Angeles County, I really wondered, with the nurses and the patients that had COVID-19 here at this hospital, why had no one really reached out to us yet? And so we reached out to them and we started knocking on doors, and we went to the Department of Public Health and knock by knock and door by door, doors opened, and we broke down some walls and some barriers. And we drove up there one day and we said, we're not leaving until we have vaccines, but don't give me enough vaccines just for our staff. Give us enough vaccines to help support the Black and brown healthcare workforce here in South LA, and to make sure that we can help get our entire South LA community vaccinated. And that was the commitment we made from the very beginning. It wasn't just about us. It wasn't just about our facility. We were going to put on our own life-saving oxygen mask and then turn to our neighbors and get them vaccinated as well. I know that my colleagues who work in intensive care units around this country are working around the clock to save people's lives, to manage their ventilators, and to keep them from dying. The least we can do here from Kedron is to work around the clock and to get as many vaccines into arms. It takes less than 30 seconds to vaccinate someone. It takes more than 8 to 10 minutes to document it. Those barriers we got to cut down, and we've got to get 1 million doses out into the arms of Angelenos just from here at Kedron alone in the first 100 days of this Biden administration. And if we take that approach and that intensity and that passion, I promise you we're going to be a lot closer to getting back to our regular lives.